IV catheter insertion. Insertion of an intravenous cannula is connecting a tube into a patient's vein so that infusions can be inserted directly into the patient's bloodstream. Peripheral IV catheter insertion involves selection of a venipuncture device and an insertion site, application of a tourniquet, site preparation, venipuncture, catheter securement, and dressing application. Selection of a venipuncture device and site depends on the type of solution to be used, frequency and duration of infusion, patency and location of accessible veins, the patient's age, size, and condition. For an older adult, choose an area with more subcutaneous tissue and skeletal support for better device stabilization, keeping in mind the need to conserve access for future therapy. Indications. Indications for IV therapy. For administration of fluid. For administration of medications. For administration of chemotherapeutic agents. For nutritional support. For administration of blood or blood products. For administration of radiologic contrast agents for computed tomography, CT, magnetic resonance imaging, MRI, or nuclear imaging. Veins. Veins are unlike arteries in that they are superficial. Display dark red blood at skin surface. Have no pulsation. Valves. Present in most veins. Prevent backflow and pooling. More in lower extremities and longer vessels. Vein dilates at valve attachment. Types of IV needles. Steel needles, butterfly catheters, named for the plastic tabs that look like wings. Used for small quantities of medicine, infants, and to draw blood, although the small size of the catheter can damage blood cells. Usually small gauge needles. Over-the-needle catheters. Peripheral IV catheters are usually made of various types of Teflon or silicone materials, which determines how long the catheter can remain in your vein. These typically need to be replaced about every 1 to 3 days. Continued. Inside-the-needle catheters, larger than over-the-needle catheters, typically used for central lines. Equipment. Antiseptic solution, chlorhexidine, preferred. Gloves, single-use tourniquet. Peripheral catheters with passive and active safety mechanism. Needleless connector. For solution with attached and primed administration set, as ordered. 10 ml pre-filled syringe, containing preservative-free normal saline solution. Equipment continued. IV pole. Transparent semi-permeable dressing. Local anesthetic. Sterile gauze pad. Labels. Gauges. Needles and catheters are sized by diameters, which are called gauges. Smaller diameter equals larger gauge. That is, 22 gauge catheter is smaller than a 14 gauge. Larger diameter equals more fluid able to be delivered. If you need to deliver a large amount of fluid, typically 14 or 16 gauge catheters are used. Selection of an insertion point. Evaluate the patient veins. Select the vein and point of insertion, remembering. Cannula should be positioned at the opposite side of body in respect to the planned surgery. The median cavital vein should be reserved for blood sampling. The sites previously irritated by injection or cannulation should be avoided. The insertion site should be easily approached, and the presence of cannula should not create patient discomfort. Finding a vein can be challenging. Go by feel, not by sight. Good veins are bouncy to the touch, but are not always visible. Use warm compresses, and allow the arm to hang dependently to fill veins. A BP cuff inflated to 10 mm of mercury below the known systolic pressure creates the perfect tourniquet. Arterial flow continues with maximum venous constriction. If the patient is not allergic to latex, using a latex tourniquet may provide better venous congestion. Avoid areas of joint flexion. Start distally and use the shortest length/smallest gauge access device that will properly administer the prescribed therapy. Be aware, blood flow in the lower forearm and hand is 95 milliliters per minute. Preparation of puncture site. Explain to the patient the procedure and purpose of cannulation. Clean the hands. Clean the skin surrounding the cannula insertion site with soap or detergent solution, for example, the site at the hand palm, the palm and forearm. Clean insertion site and surrounding field with solution of chlorhexidine in ethyl alcohol or isopropyl alcohol. Wait 3 to 4 minutes till aseptic solution evaporates. Hold the cannula firmly with 3 points grip. Such grip minimizes the risk of contamination and ensures correct positioning between the needle point and the catheter tip. Insert the cannula into the vein at a low angle. Entry the needle into the vein is indicated by the presence of blood in flashback chamber. Advance the cannula a few millimeters further into the vein, which ensures that catheter tip also enters the vein. Avoid touch contamination by holding the hub by the wing or protection cap. Withdraw the needle partially to avoid exit through the posterior vein wall. Firmly hold the flash chamber and advance the catheter off the needle into the vein. Withdraw the needle completely. Press a finger on the vein above the insertion point to avoid blood spillage. The needle must never be reinserted while the catheter is in the vein. This may sever the catheter. Remove the luer lock plug by pushing the needle to the waste container. Close the cannula with the luer lock plug. Fix the cannula to the patient's skin with proper dressing. Fixation of the cannula should not affect blood flow around the catheter and should prevent movements of the cannula, which can result in mechanical irritation of the vein. Check the correct placement of the catheter by injecting about 5 milliliters of sterile physiological saline. Record date and time of insertion. Special considerations. One nurse should make no more than 2 attempts at insertion because unsuccessful attempts limit future attempts and cause the patient unnecessary pain. If you fail to see flashback after the needle enters the vein, pull back slightly and rotate the device. If you still fail to see flashback, remove the cannula and try again with a new cannula. After removal, monitor the site for 48 hours to detect post-infusion phlebitis.